coughing, sneezing, and runny nose. These used to be some of the symptoms of the common flu that we have all grown accustomed to. However, with the recent outbreak of swine flu in Mexico in the past week, these symptoms could now indicate a far more serious illness. Swine influenza is a contagious disease that affects pigs. While outbreaks in pigs occur year-round, people were usually not affected until now. Although there have been no reported cases of swine flu on the Berkeley campus, University Health Services are working to closely monitor the situation. But how does this virus spread? It has been confirmed that you can get it through direct contact with infected pigs or from a person with swine flu through coughing or sneezing. So what are some precautions that you can take to keep yourself safe?
The public health officials definitely want us to emphasize hand washing, covering your cough so not coughing in your hands and then shaking somebody's hand later.
According to the Center for Disease Control, there have been previous instances of the virus spreading to people, but transmission in the past has never occurred on such a large scale as it has done this time. Is this cause for concern?
I know that my parents back home are pretty concerned about it.
I feel like pretty much in the United States, if people take the precaution and don't just ignore it, if they'll go to the hospital or the doctor when they do feel sick, it'll be okay.
My dad just called me up, and I think what worries him the most is that you're in such a concentrated area in Berkeley, that there's so many people and there's so many students and there's so many people coming from outside of the country.
I did consider having my daughter wear a mask to school because I think children are a little bit higher risk because of their, the way doorknobs and playground equipment and things of that nature. So it is a concern, and if it gets much bigger, I probably will take some steps.
Many people turn to face masks as a source of added safety. But just how effective are they?
They're effective in medical situations or hospitals if you put them on patients. So when patients cough or sneeze, their droplets don't spray all out over their neighbors and people in the room. However, they're not that effective in people who are not sick wearing them and walking around sick people. Why? Because they don't provide an airtight seal, so when you inhale, air can go around the mask, and if that air has droplets and vapor in it from the sick person, you're going to inhale it just as if you didn't have a mask on.
Recently, the World Health Organization has raised the current level of influenza pandemic alert to phase 5 on a scale of 6.
Given that there are so many new cases popping up everywhere, we very much expect that, we already know there's a couple new cases in the Bay Area, in Marin County, maybe in Santa Clara County. It wouldn't be surprising to me if we had one in Berkeley within the next few days or certainly by the next week, and San Francisco and probably the whole Bay Area.
With the onset of a possible pandemic threatening the safety of the United States, citizens are questioning the preparedness level of their local communities and what extra security measures are being enforced.
Based on the actions that I see them taking now, which are not much, I think it will grow.
So we do have a lot of preparations that have been made. We did convene today a pandemic planning preparedness group today. The reason we're doing that is we need to get ready in case the severity suddenly switches from mild, which is where it is now, to something much more severe. If that were to occur, then we would have to take, more aggressive actions in protecting our campus community and the public.
However, a pandemic would affect more than just residents in a single city, leading some to demand the government to take drastic action.
Instead of thinking about being politically correct, they need to really make sure that we don't have an epidemic here in the United States, if possible, and keep it contained.
To stay up to date on the latest developments about swine flu, visit the University Health Services website. In Berkeley, for CalTV, this is Caroline Voung.